A new world of connected digital health. Welcome back to another Techstination interview. With us is Jeff Ray, Executive Director of Business and Technology at Omron Healthcare. Thanks for taking the time again, Jeff.
Thanks for having me, Fred. I appreciate it.
Well, we spoke to you, I think, about a year ago when you unveiled what you call VitalSight, a service that can transmit blood pressure data that you take at home to your doctor. Tell us how it's evolved.
Yeah, so when VitalSight started, we deliver a kit to a patient that's enrolled through their physician that generally includes a blood pressure monitor, a weight scale, and a digital hub that will take that data that the patient records and sends it directly to the physician. We have had a long history, about 50 years, in the market of helping people with hypertension manage their condition. And so as we've developed those devices over the past decades, we were hoping that people were having those honest dialogues with their physician about what's actually going on in their daily lives at home. And so we built a VitalSight platform with a lot of that insight that we've gleaned over 50 years. But as it's evolved, since we've kind of put it into the wild, and we've now had physicians using it and patients using it and giving us feedback, we've really kind of adjusted how we deliver that information to the doctors. It's no longer just numbers. As we work with physicians, it's about putting context and insight into those numbers. So working with them, getting closer to more of decision support. So we've taken a lot of great feedback from physicians and put that into the platform of how they want to look at data, how they want to understand it, how they can communicate back and forth with their patients. And we've seen tremendous results even from the patient side, where they've gone on programs where they've lost up to 50 pounds in some cases and actually reversed some of their hypertension trends, and becoming from somebody that was hypertensive to somebody that was more normal as far as their blood pressure goes. So we're very pleased with the results.
Step us through the patient experience here.
Sure. So when you talk to your physician about VitalSight, they're going to explain the program to you, essentially that a kit will be delivered directly to your house. We will have one of our VitalSight patient coordinators connect with the patient, explain the program to them, and it's very simple. Matter of fact, VitalSight, the whole intention of it is about simplicity. We don't want people to have to make huge changes in their lifestyle to be able to use VitalSight. So they just, when they receive the kit, they plug the hub into the wall, they put it on a counter or a shelf somewhere, and they forget about it. All they have to do is remember to occasionally take their blood pressure and take their weight. So once they're using it, that data, there's nothing more they have to do. So just like you wake up in the morning and you brush your teeth, you step on the scale, you take your blood pressure, and then you're off with your day. That data is automatically transmitted to your physician in a way that they can understand it. It lets them know if things are looking a little bit out of whack, and then the physicians can contact the patients if something doesn't look as though it should. A great example of this is a lot of times patients are prescribed medications when they're hypertensive. And it can take physicians up to a year or more to find that right combination that's going to best suit that patient. Or a lot of times a patient is put on medication, but 30% of all medications are never filled. And even worse is half of those that are filled are never actually taken as prescribed. And so we can actually show the data to the physician about how those changes in medication, or if they're being taken, and if not, how that's impacting their blood pressure. So really, it's all about fostering that dialogue between physician and patient.
So how much techie knowledge is required on the patient's end of things? Do they need to set up the hub with their Wi-Fi network, or how does it work?
That's kind of the beauty of it. When we started, we actually started with a mobile application, which was great for some patients. There are definitely some patients out there that are savvy enough to be able to use a mobile app to upload their information and transmit it. But we found that there's a pretty big gap when it comes to healthcare and connectivity, kind of that digital divide. where not everybody was comfortable using a phone, or they didn't have access to a cellular connection where they were at. So that's where we shifted and we said, we're not going to make this app-based. We actually are going to make it hub-based, where it's a cellular hub where they don't have to do anything. They don't have a plan, doesn't cost them anything. There's nothing more they have to do. Essentially, when the kit shows up, they plug it into the wall and everything works. Because before we even send them the kit, we configure everything so it's already going to work out of the box. We've linked that hub directly to their patient ID number, called an MRN number. So we know exactly all the data that flows to that hub. We know exactly where to put it so that their physician and their physician alone can see that information. So it was all about how do we make this as simple as possible using the technology, but not relying on the patient themselves to have to understand the technology.
I thought you said that there's a way that a physician might know if I, as a patient, am taking my medication or not. Is there, how would they know that?
Well, generally, we see it in the results. And so there's a couple different ways we can go about that. Generally, when we see that a patient is taking their medication, we see the impact of that on their blood pressure readings. If we see that for an extended period of time, that say you're normally, 130 over 82, and then all of a sudden you jump up to 147 over 95, and we see that trend continue for a while, our patient coordinators will contact the physician and their staff. We'll actually, either the physician or our patient coordinators will reach out to the patient and confirm with them, hey, we've seen a slight bump in your readings. I'd like to ask you a little bit more about that. And so a lot of times what we find out is by asking them, they kind of fess up and say, yeah, I haven't been taking it, or hey, I had a refill, but I haven't had a time to swing by and pick it up. So that is generally how we do it. If we have somebody that wants to know more about their information and need a little bit more help, we can actually assign a kind of a medicine cap that's got Bluetooth built into it that communicates to the hub, where every time you open the cap to take your medication, it sends a signal to the hub and then to the doctor that you've taken your medication for that day. We only use that in more severe cases of people that need help, but it is an option that we provide.
Interesting. What about the costs?
So for the most part, we built this program using the CMS, which is the Center for Medicaid and Medicare Services, and their reimbursement. So there's very little cost, if any, to the patient. It depends on what kind of insurance programs you have. But we didn't want to put the financial burden of a program like this on the patient. It's actually going through, many cases, Medicare. But what's more exciting is we're seeing every day more and more private insurance programs covering this because they see the benefit. We've actually done a number of studies where we're very focused at Omron on having an impact on patient outcomes. A lot of the insurance providers who are also interested on patient impacts, but they also want to make sure that it's the ROI is there, so the return on investment are there for the insurance companies. So they want to say, okay, if we put them on the program, are we going to see a reduction in cardiac events? Are we going to see less admissions to the emergency room? Are we going to see people staying more compliant and adherent on their medication? So they want to see, as well as the outcomes, they want to see how that translates to their bottom line. And so we've done a number of studies that show that a typical patient will save about over $110 per month to that insurance provider by staying on this, because they're not going into the emergency rooms. They're not having cardiac events. They're staying compliant on their medication. They're engaging in their own self-care. And so if they understand what's going on and how their condition is being affected by the decisions they make every day, they're much more likely to stay engaged in the program, which we see has that impact not only on outcomes, but on the finances as well.
And now I assume you have some data to really back all of that up. Do you have some success stories too that you can point to?
Sure. I mean, boy, there's so many of them. When we've done the studies from the insurance company perspective of having the impact, we've done studies with Northwestern Medicine in Chicago, Mount Sinai out in New York, Highmark Health out in Pennsylvania. We're starting a new study pretty soon with the University of California Health Systems. And again, these are all showing how we can have impacts, and they've all seen it. But drilling down even to a more granular level from a patient perspective, we've seen people lose weight. We've seen people that have had cardiac events go on the program, and they've had that fear that they were going to have another event, because a lot of times when you have that first event, within a couple of months, you're at risk for having a secondary one. And so we've seen a reduction in that as well. We even had one patient, again, this goes back to that serving an underserved community where maybe they don't have connectivity. We had a patient that was using our program, and we would see that they would go for a couple of days and data would come in, but then there would be a couple of days where data wouldn't come in, and then it would come in again, and then it would stop. And so we were trying to figure out, okay, was there a technical issue or what's going on? Why is it sporadic on how the data is coming in? It turns out that that particular patient was actually living in a shelter. And the only time he could transmit his data was when he got into a shelter and was able to plug in that hub. So we've built this so that virtually anybody, regardless of tech level, regardless of your housing situation, whether you can afford a mobile phone or connectivity or Wi-Fi, anybody can use this program no matter where you're at. So we've been very pleased with the success that we've had.
For more info, where do we go?
You can check out omronhealthcare.com/VitalSight, or speak with your physicians about VitalSight and have them reach out, because there's a lot of great information that we have available on where the program can be engaged with your physician. And if your physician or your hospital system is not currently using VitalSight, they can absolutely reach out to us, and we can tell them a little bit more about that so they can use that with their patients.
Again, it's omronhealthcare.com/VitalSight. Jeff Ray, thank you for taking the time with us.
Thank you, Fred. I appreciate the time.